Hey guys, it's Josie doing our second vlog for our final semester. Here are some questions. Give your top 10 tips every clinic student should know going into clinicals. Number one would be to not worry about the first day. It's really not as awful as you would think it would be. It's not as hard jumping into the procedures as you would think it would be because some preceptors allow you to just jump right in, which is really nice. Like on my first day, I think I did every single case. My preceptor sat on the stool and made me do everything. So that was really nice to be able to jump in and basically learn the steps and the feels about what it's like to do things on your own and on an actual human, not just a mannequin. Another thing would be to be positive. I think that's a big thing because a lot of people in the OR aren't the friendliest or the nicest, so I think that being positive about the people you're working with, about the information that you're given, I think that plays a big part in how your day is going to go. So being happy and positive, I think, really helps. Another thing would be to take all the advice you can get. Doesn't matter who it's from. Just learn and try to grow, even if you're getting information about, the hospital or different procedures or the people you're working with. I think you can never learn too much. Even if you are like a seasoned tech, I think that you can never learn, you can never cap your learning abilities. I think that you continue to learn every single day. So yeah, take all of the advice you can get. Another thing would be be friendly. Say hi to everyone. I think that's a big one because there are so many people that I see that are just look like they're having the worst day ever, and they just aren't smiling, and you say hi to them, they don't even acknowledge you. And I've heard people say that about other people, and it just kind of makes for a bad day, I guess you could say, between those people. Like I was in a room and a girl was not in a good mood, and she wasn't, everyone was talking to her and she wasn't really talking back, wasn't really saying hi to anyone. And so it was just kind of like a little distress going on. So I think being nice and happy, I guess. Another thing, if you can, I know sometimes it's hard, like at Munson you can do it, you can go in and you can see what room you're in and the cases that you're going to be doing the next day. I think that's really, you can do that at the surgery center too. Going and finding the cases you're going to do the next day and then looking them up, even if it's just the instruments or like the anatomy. I think that's something that really helps me, is if I know like the anatomy, and I usually am asking the surgeon too in the surgery, like what's this, what's that, can you talk me through the surgery? And most of them will. But I think knowing the surgery beforehand or looking it up kind of helps a little bit that way. If you're asked any questions during the surgery, you might be able to answer them. So I think that's a really, really big, helpful tip that hopefully will help you guys. Another tip. Let's see. Every single day that I'm in the OR, I tell my preceptor whether or not I have done that case before, whether or not I've worked with that surgeon, or if I know any of the instrumentation or not. I say that those three things every single time. Just because that gives them an idea, because I've been in a room where I didn't really say anything like that, and my preceptor thought I could do it all, and they basically weren't really at the table helping me. They weren't scrubbed in or anything, helping me with the surgery or setting up the table. And so I kind of had to do it all on my own, because they were over there talking or they were walking in and out of the room. So that was really hard and confusing because I had no idea what I was doing, and I eventually asked them, can you help me? I don't really know what I'm doing here. And so if I would have communicated a little bit better in the beginning of the case, they probably would have been able to explain the procedure and explain the instruments we were going to use. So I think that being very open about your knowledge on the case and the instruments is a huge, 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 huge thing that you can do to have a better relationship with your preceptor too. Let's see, another tip would be I don't know. I can't think of any more. If I think of them, I'll let you know. Let's move on to the next one. What are the 5 things that are the most annoying preceptor attributes? I really want to say there's a lot of annoying things they do. Maybe like one thing. But some things that I guess bother me. It doesn't really bother me either. I don't know. To answer this question, I would say most preceptors, if they're when they're scrubbing with us, that's their case too, and they want to do the procedure too. So a lot of times if the surgeon asks me for an instrument, they'll grab it right away and they'll do it, and sometimes they'll just throw it back down on the mail stand and say, I apologize, I'm sorry, I should be letting you do this. And it doesn't bother me really, and it's not like a annoying attribute that they have, because I really understand it, and I'm sure that if I'm ever in the preceptor role that I'm going to probably do the exact same thing. But that happens often, and I'm sure a lot of people get annoyed by it, but it's understandable. Some preceptors are not the best teachers, which I don't really understand how they're a preceptor, how they're like allowed to precept us if they're not the best teacher and they know that they're not the best teacher. Kind of come across that, and I've had them say, she's not going to be the best teacher or the best person to work with, but we'll put you in there anyway. And I'm just like, don't really understand that. She wasn't awful, but I mean, I learned some good tricks with her, but she wasn't as patient as a lot of the other ones were. So that's kind of a little bit bothersome. Some preceptors just want you to do it all because, that's personally how I learn. I like to be just thrown into it, and I'll eventually learn. I'll learn by my mistakes. Some people like to be taught, step by step. But there's some preceptors who will just leave you alone and let you do it all, which is nerve-wracking, especially if you're like at the surgery center, because they go by very, very fast in between cases, and you have to get everything set up, and sometimes it's like, oh no, like this is not going to be ready when the patient comes in, when the surgeon comes in, nothing's going to be ready. So sometimes that's a little worrisome. I usually will tell the preceptor, hey, I'm going to need some help because I don't know what I'm doing. Another thing that I would probably tell students is I did not think I was ready to go into clinical, and I wasn't when I went into clinical, so it's okay to feel like that. I still feel like I need months and months and months of practice before I'm out on my own, because I feel like I know nothing. I mean, not that I don't know nothing, but the thought of being on my own, having to do it by myself, is very frightening. So it's okay to feel like that, because, we are babies learning this stuff, and there's so many things that you'll have to learn, and so much more that I have to learn. So it's okay to feel like that. But all right, next question. What have been the 5 most positive comments, compliments, or moments or experiences you've had in OR? It's always really nice when a surgeon comes up and tells you that you did a really nice job. And I've had some surgeons do that. There's some surgeons who are really nice, and some surgeons who are really, really cool about students and teaching you the procedure. Like, sure, you can read the book and watch the video, but being there firsthand, having someone talk you through it and letting you look at everything individually in there is an awesome, cool experience. And to have some surgeons do that for you is very awesome. And preceptors will give you some really cool comments and evaluations, and knowing that you've been one of the best students by far in that certain specialty. Being told that is really fun and cool. A positive experience. Probably just being able to, like, on Friday I was with a surgeon who was just very, very laid back, cool, like, crack jokes the whole time, like, trying to be funny, like, and him telling, you these jokes and telling you, I don't care that you're a student, you're gonna, do all this right here with me. And I mean, so the most positive, I think, has to do with the people that you're working with. If they're fun, positive people, I think that you're gonna have a positive experience. And so I'd say probably like 40% of the time, that's how it goes. I'd say like 10, 15%, maybe even 20%, where it's like you kind of feel like you're just like walking on eggshells because the surgeon or the people you're working with are just not in the best moods. Okay, last question. What is the one thing that you want to pass on to every student behind you? I kind of threw that in with my tips. But just to have fun and to don't take anything personal. There's going to be so many times where a surgeon is going to say something to you, or a preceptor is going to say something to you, or a nurse, and they're going to say it, and it'll probably, make you feel bad or make you feel like you did something wrong. They either aren't the nicest of people, or they're just really mad, and you're a student, and you probably didn't do something correctly, or maybe it was an accident, or it wasn't even your fault. They'll throw it on you, and just don't take it personal. Just say, apologize, or let it go, and not to worry about it, because that's going to happen often. And if you let that bother you the whole day, you're just going to have a really bad day and make you not enjoy what you're doing. And we get to do some cool things, so try to not take things so personal and be happy and positive. That's what I got. And I will catch you guys in the next one. See ya.